Is there a triage tree that handles like different skincare issues? Because we talk a lot about the different people on your medical team, right? And there are a lot of people involved in your baby's life, especially if you have other care providers outside of your pediatrician. So do you kind of have a triage of who should address what issues?
Absolutely. So definitely different healthcare providers provide various skincare issues and help to resolve those. So your orthotist or your AFO provider is someone that adjusts and modifies the fit of the boot and the bar and addresses kind of the mechanical issues. So such as that boot being too loose or too tight or being outgrown. Our job is to really optimize the fit and the connection. We call that purchase of the AFO onto your cutie's foot and ankle to optimize the outcomes. And we are all, again, trying to achieve the same goal, which is the correction of that clubfoot deformity. And your orthopedic surgeon and the actual physician providing the care, they're the ones that are really the overseers of everything. And so really, if I know that I'm drawing the line and coming close to something outside of my scope of practice, such as athletes, but I'm going to go right back to that referring physician and say, hey, like they need a little extra help here. If for some reason we're not getting a lot of feedback from that referring physician, that's when you can kind of recruit the external people, whether that's your primary care or your pediatrician, and then they can really help to work out a referral to pediatric dermatology or podiatrist if there's something such as athlete's foot or severe eczema or those ingrown toenails that have gotten to the point where even a pediatrician couldn't really handle it. So really there's a lot of triage that does happen, but in most cases your AFO provider is likely the person you can get a hold of the quickest and the easiest, and an easy way to communicate back to. And then we can always make that decision if we do feel like it's something that's going to be outside of our scope.
Awesome. Yeah. I think that that's such a good delineation of who goes where and when. It's like the first stop is the person that fits the boot, and then they can help you determine what the next person should be if it is outside of their scope.
Mm-hmm.